Well, here we are, another edition of Pets and People. Marty Hobson joins us once again, veterinarian Marty Hobson, and we're here today to discuss one of the most frustrating problems for cat owners. Good morning, Marty.
Good morning, Matt.
What is this frustrating job, this problem for cat owners we're talking about?
Nothing can destroy a relationship between an owner and a cat than problems with the cat eliminating outside the litter box. Yeah, we haven't had a chance to talk about this over the many times I've been here, so I thought it was time we tackle this issue.
It's been a while since I've had cats in the house and have had to clean that litter box, but I expect there's no easy answers to this one.
It is a really complicated issue, but there are some simple things people can do if you are having a problem with this. And first of all, if you have more than one cat, you need to figure out who the culprit is, or is everybody, part of the problem?
Right.
So you might need to separate them, and some people even set up video cameras to see what's happening when they're not available to watch. And also think about what they're doing. Are they peeing but just outside the litter box, or are they doing that on carpet? Are they defecating on your clothing? Are they spraying, which is defined as releasing urine usually on a vertical surface? What about in a tub or on a tile floor? So really take note of these things, because when you visit your veterinarian, they're going to want to know a complete history with these details.
So once we do that Sherlock Holmes detective work here, Marty, what can owners do with the clues?
Well, there's a lot of parameters to think about, so we can talk about some of them. The main one that a lot of people haven't really investigated is litter box aversion. They just don't like the box for some reason. And some of this may be a bit surprising. Like, how many bathrooms does your family have, Matt?
We have, let's see, there's 5 people generally in our home, and then we have 3 bathrooms.
Right. Well, for cats, the general rule of thumb is 1 litter box per cat plus 1.
Okay.
So if you have 2 cats, Matt, you're supposed to, perhaps, if you can swing it, have 3 litter boxes. That's not always possible, but that's the general recommendation. And these should be in the cat's main living area, especially with an older cat that may have arthritis. You wouldn't have your 95-year-old grandmother come and visit and expect her to go down 3 flights of stairs to use the bathroom. So we generally don't recommend that the litter boxes be down in the basement next to the furnace or washing machine. The main thing is, though, Matt, is the box clean? The cats generally prefer a clumping, unscented litter. They have an aversion to strong odors, both bad and good, and they need a clean space to eliminate it. So if they're just missing the box, it may be that it's not clean enough. You really need to scoop that out once a day.
What about, I've seen the open trays and then the covered boxes. What about those covered boxes?
Well, I like to think of this as kind of like a porta potty or an outhouse. I don't know about you, but I really don't like those. There's such an enclosed space and a bad smell. Cats want to be able to see all around them 360 degrees and know where their escape route is. So uncovered boxes are best. And Matt, size matters.
Size matters? Really? How?
Well, a study was done here at the ABC a few years ago by Dr. Norma Guy that I helped with, and it showed that when you make all the other parameters the same, like the litter type and amount and location and the number of times it was cleaned, cats preferred larger boxes than the usual ones you get at the pet store. Now, there are larger ones available now, but what we were using and recommending was those Rubbermaid under-the-bed storage boxes, the ones that are sort of about 4 feet long, and they're better, it's thought, because the cats can stretch out to scratch at the litter, and you have to take into account the height of the sides. Like kittens and older cats with arthritis can't get into a box with really high sides, so they may be just peeing and pooping outside the box.
A couple of reasons there why they might not like the box or litter. What else?
Well, I talked about aversion to the litter box, but we should mention texture and substrate. So most cats, you don't have to train them to want to use litter. They're just kind of hardwired to do it. But what if you've cleaned out the box and you're using the right type to make the litter box a very friendly place, but let's say you drop a piece of clothing on the floor or plastic bag and your cat pees on it. So your cat might just really like the feel of soft things like clothing or towels, or might like the feel of a hard surface if your cat is peeing in the tub or on the tile floor. So people can try some tricks, like if your cat is peeing on the carpet, you could put carpet scraps in the litter box with just a little bit of litter and then gradually add more, sort of changing them over gradually. Or put tiles in the litter box, whatever it takes. Or if you change the type of litter, they might not like that. Your cat might have eliminated on the carpet or in the tub for whatever reason and then just thought, hey, that feels really good compared to like keeping my legs crossed and waiting for my human to clean the box. So I'll just keep doing this.
So you talk about using the textures that they prefer in the box and transitioning that. What else can owners do?
Well, as I said, you can try to make the box more attractive, or if they're peeing in a place you don't want them to go, try to avert them from that place.
Right.
And that kind of segues into location preference and aversion. I mentioned that maybe they don't like the location down in the basement. Maybe they had a bad experience there, like the furnace came on and scared them, or your other cat attacked them while they were using the box. Or maybe they had some pain when they were urinating, so now they associate that location with hurting. Or maybe they just really like that spot behind the couch mat or in your closet. So some strategies would be to put the litter box where they're already going, and then you gradually move it a few inches every day to somewhere where it would be more convenient for you, not in the middle of your living room. And another strategy would be to not allow them access to that new favorite spot that is not appropriate. So if you know they don't like plastic or tin foil, the feel of that on their feet, you could cover up that spot with foil or plastic sheeting, or just keep the door closed to the closet or the bedroom. That's pretty common sense. You could even hang like little balls of paper or foil from strings, so they're kind of bouncing around like a mobile. Anything to sort of gently dissuade them from using that location.
And the cats are just doing what comes naturally here, so I assume you don't want to punish them, though?
No, we would like to gently convince them to use the appropriate location, but make them think it was all their idea in the first place.
Smart. You're talking about the psychology here, but what about the biology, too? Could there be medical reasons around some of these issues?
Absolutely, and that's probably the most important consideration, so that's why I thought we could talk about it last. So there are medical reasons for your cat not to use the litter box. It's always best to seek help, especially if you've tried some of these suggestions and they're not working. Cats can get bladder infections, but more commonly they get a cystitis, like an inflammation of the bladder, and that can be stress-related. So when they need to go, they really need to go, and it's painful, so they don't always make it to the litter box. Medications can be used to relieve that inflammation or an infection if it's there, or sometimes there's behavior-modifying drugs we use for stress. And food can also play a role that might be producing crystals in the urine, which cause pain and inflammation. Also in older cats, and younger ones too, we can see kidney disease or diabetes, and that makes the cat drink and pee a lot more than normal. So you do need to talk to your vet to see if any of these things are an issue, and testing and medication or a diet change might be recommended.
Great advice as always, Marty. Thanks so much for being here.
Thanks. I just want to say it's such a complex issue. We obviously don't have time to cover everything here.
Right.
It's a puzzle for sure, but if people have a lot of patience, hopefully most cats will get back on track.
All right, Marty. Thanks so much.
Thanks, Matt.